Dr. K. Chen and myself, we run the respiratory and sleep service and research team. So what I'm going to tell you is basically share with you what facilities we have here. And we are also expanding some service and also research work at the Children's Hospital and also what projects we're doing. Okay, so once again, obviously I won't be able to cover everything in this short period. I'm happy to answer your questions at the end. Yeah, or you can send me an email. So okay, so we've got, I wouldn't say a dedicated sleep lab. So we've got a 2-bed sleep laboratory here. It has been running okay, and even though it's a very small size, we have been relatively productive. As I said, we'll be doing some sleep work at the Children's Hospital as well. So our main research interest is sleep disorder breathing. I could get rid of this. No, not like that. Push it up. Yep, yeah, okay. So we really started back in 2001, started with a cohort, and then we're still following up this cohort. Okay, other work related to sleep, obviously sleep is quality and also quantity. The quality is not important, but how much you sleep is also important. So those are the things we've been doing. Okay, in terms of sleep disorder breathing, we've been looking at the epidemiology, the mechanisms, complications, longer term problems. Now we are looking at what happens to a child when he has got sleep apnea at 6, and what's happening to him at 26. So that's what we're doing, a longer term follow-up. Okay, some ongoing projects. Majority of our work is clinical. We've started doing, especially Kate has started doing some bench top work and laboratory work, looking at biomarkers, looking at different inflammatory cytokines. Everyone's talking microbiome. Obviously, we're trying to do it as well. We've got a few projects with other colleagues from CU and also outside CU. Okay. So this is our team. We've got one colleague, John, is still with us, but remotely. Okay, has recently gone to Toronto. He's now doing very well, actually, working in a very big sleep center. So he has got an appointment with us, and we are sort of still doing some joint work. So as I said, those are the work we are doing. We welcome ideas. Obviously, I'd always encourage my students or colleagues to come up with novel ideas. Okay, so what you need to do, all right, whenever you take up a position, you need to read, you need to go and meet people, you need to go and attend conferences. Okay? If you are thinking of being a budding scientist or researcher, that's what you need to do, because things are moving so rapidly. Okay, so go and meet people, talk to people. What are the ideas? Okay, so you've got to have an intuitive mind. Okay, so I think I'll stop here. I don't think we've got any more slides, do we? No? Okay, I think, Kate, do you want anything to say? Do you have any questions? As I said, you can ask me afterwards, you can send me an email, I can show you around to our sleep lab. So, any questions? No, very nice meeting you. I shall go to another meeting. All right. Very nice meeting you. Take care, all the best.